Welcome to our panel, The Health Trust Gap and How to Fix It. I'm Dr. Natalia Peart, psychologist, leadership and performance consultant, author, and regular Forbes contributor. And I'll be your moderator today. And joining me for this timely, lively, and just as important discussion are some of our esteemed panelists that are going to bring a variety of perspectives to this topic, from government to entertainment to business. So if you could please introduce yourselves, starting with you, Ed.
Thanks, Dr. Peart, and thanks to the rest of the panelists for being with us today. Simcox, and I'm the Chief Strategy Officer at Lifeomic. Lifeomic is a cloud-based precision health company. And prior to Lifeomic, I served as the Chief Technology Officer at the U.S. Department of Health and Human Services, where I oversaw innovation programs, prize competitions, and data sharing initiatives across HHS 29 agencies and offices, including the CDC and the FDA.
Thank you. And to someone who needs no introduction, Kristen, over to you.
Hi, my name is Kristen Bell. I suppose that I am providing the layman's perspective here as someone who very much cares about the health trust gap and how to fix it. I'm by trade an actress and a singer and a producer, and there are a lot of issues I care about. And one of them is the health trust gap because there are a lot of medical professionals in my family. My mom and my aunt are a nurse. My stepfather was a surgeon, and science and medicine is incredibly important. I also, we're about to get to Miss Jessica Malaty Rivera, but she has been one of my dearest friends for a very long time and someone in my personal community that I lean on for scientific information. So I hope to, I'm not qualified to be here, but provide a little bit more of the personal perspective of how you are to lean on medical professionals in your life.
Thank you. And last but certainly not least, Jessica. Please take it away.
Hi, everyone. Thank you so much for having me. My name is Jessica Malaty Rivera. I am an infectious disease epidemiologist, and I'm currently working with the COVID Tracking Project, where we are collecting and analyzing data on the COVID-19 pandemic from all 56 states and jurisdictions. On the side, I do a lot of medical myth busting and science communication on social media, especially on vaccine literacy and data literacy. And I feel very passionate about closing this gap because what we've seen, and especially in this pandemic, is that it's only widened. And so hopefully this session will be providing some tools for your toolkit so that we can help close that gap.
And thank you also to our live illustrator joining us, DiAngele Augustus, who has a passion for storytelling, using art to make it accessible for all. Now, they'll be illustrating live visual notes of our conversation today that will be shared on the Lifeology website. So to kick it off, I want to start by talking about this concept of the health trust gap. Now, while it's not a new idea, 2020 certainly spotlighted the importance of communicating information and how it can save lives. So let's start with that. What's this health trust gap? And how have you seen it manifesting itself? What's the problem in our climate today? Jessica, let's begin with you.
Yeah, so I think that there are many ways to define the health trust gap. And I think one way, especially reflecting on 2020 to define it, is to look at the distance that's grown between health professionals, researchers, clinicians, and the general public. For the first time in a very long time, all eyes are on things that was prior to the pandemic, kind of siloed and behind closed doors when it comes to clinical trials, when it comes to testing new drugs and even a vaccine. And now it's on full display in the form of press releases and in the form of approvals, and the whole regulatory system is just out. And I think because of that, and because of the fact that there hasn't been a prioritization of science communication, which is to translate the science so that it's accessible to everybody, what's happening is that there's a growing lack of trust and a growing aversion to what's happening in the science and medical community.
Thank you for that. Ed, anything to add?
Yeah, from the government's perspective, the government is really good at telling people what to do, coming out with policy ideas and everything. But In a situation like the one we have with the current pandemic, where we're talking about a novel virus, a new virus, something that is reacting to medication differently, something that has different patterns and modes of infection than we're used to seeing. We're continuing to learn as we go to this very day about the behavior of the virus and the way it impacts communities and individuals. We didn't slow down to then be able to speed back up in a lot of ways. And I'm speaking on kind of behalf of the government, various parts of the federal government, state government, and local government, and say, hey, how are we going to communicate what we're seeing? How are we going to collect the data, turn that data into information, and then make that information actionable? What we're talking about today, I think, is super important. And there wasn't enough dialogue, definitely in government, but across the United States, about this intersection between science and medicine on one side and art and communication on the other. And I think it's super, super important.
Wonderful. So let's talk about the root of this mistrust, or the lack of trust. And what are some of these consequences? Where have we failed? What have we not done enough of? Because of course, if we think about it, right, the Tuskegee study, it looms large in our history here, right? And for those who are unfamiliar, the Tuskegee experiment, or this syphilis experiment, was an experiment the government conducted for 40 years on Black males. And the goal of that study was to truly study the course of untreated syphilis. But of course, the males who participated didn't know that, right? They were promised free medical care. They thought it was going to be for 6 months. So they were deceived, and only ended after 40 years because of a leak. So it's not only the cause of lots of deaths, but it was also the cause of huge mistrust. Jessica, what would you add about the history of mistrust?
I think it's really important to remember that groups that feel mistrust or hesitancy about innovations are not monolithic. And it's because of examples like this that we can't group them in a communications plan or even in a approach for public health in the same way, because there are degrees of trauma that exist on extreme levels in some communities. And I'm speaking specifically right now about the Black community, that, the descendants of those who were part of the Tuskegee experiments, which were not long ago. And then even looking back further, the gynecological experiments that happened on Black women during the time of slavery, and even the birth control experimentation that happened on women in Puerto Rico. So there are layers and layers of trauma that have influenced and informed reasons for hesitancy and mistrust. And I think one thing that helps reframe this conversation is to look at this, instead of it being a mistrust on the community, it's a lack of trustworthiness on the medical community. And that trustworthiness needs to be rebuilt. It puts the onus and the responsibility on the professionals who were the perpetrators of these atrocities, and it puts it on them to kind of correct that, instead of ingraining to the people who experience the trauma to forgive the trespasser. It's flipping it around.
That was an important reframe. Lack of trustworthiness. Thank you for that. So now, since we know some of the barriers and therefore the lack of trustworthiness, where that comes from, let's talk about some of the innovative solutions that's going to help us now bridge the gap, beginning with ways we can reach people and bring them into the conversation. So how should public health information be shared, and by whom should it be shared? Kristen, I want to start with you. Kristen, I think we need you to unmute yourself.
Of course I did it. I know how to be on camera, and that, don't mistrust me, guys. A mistake has been made. Thankfully, no one was harmed. I hesitate. I will say, first of all, thank you for including me in this. I hesitate to use the word should, but as a consumer of public health info, what I do from my perspective is I try to take it in from multiple sources. So anyone who's watching this as a layperson, that's a really good reminder, I think. In this, you can rarely ever read one article and say, well, that's the truth. But in an era of disinformation, I like to see consensus. I also, as someone with a platform, try to pause before sharing. You know, the great thing about the internet is it's given a lot of us a ton of confidence. And the terrible thing about the internet is it's given a lot of us a ton of confidence. So we have to figure out how to, I think, understand our responsibility as different elements in this circle of disseminating information, that it can't just be done by the medical community or the science community or the storytelling community. It really or the media, to be honest. It has to be a team effort of like-minded views that want to bridge this gap and bring science and healthy information to the public. And that goes to people who are just like reposting things. You don't want your page to turn into a tabloid. So double check, just like pause, double check. Also, I would, I would beg the medical and science community to lean on storytellers. Like, there are people out there like me who it's our job to tell a story, who are desperate to be honest, do an important story once in a while and make a movie or make a show or make a documentary. And there's a ton of data. Like, if you cite any Paul Bloom research, you know that people, the human condition, is so much more interested in connecting to the one person. You see one child in a well and your heart breaks and you want to donate all your money and you want to save the child. You see 6 children in a well and you're like, ooh, should I help? You see 100,000 children in a well and you just pass it by. And that's just a part of our brain. So isolating personal stories, I think, is a way that the artistic community can help the science and medical community get people to understand information. And I also think that, to be honest, falls a little bit on the media, in that you have to be a responsible writer. You cannot write an article that's, hey, this one guy that had X disease, all of his extremities fell off the next day. And then at the very end say, oh, but he was 1 in a trillion. You need to be responsible with how you're writing. So I would hope to see much more of a team effort.
Wow, I heard so many important points there, starting with, as you kept framing, team effort, bringing consensus, double checking, the sense of responsibility and the importance of storytelling that we're going to talk about more later, right? Hooking into that personal story, human to human, to disseminate heart to heart. Thank you for that. Jessica, what would you like to add?
I completely agree. And I think that the emphasis on consensus is extremely important, even from the scientific perspective, because as scientists, as people who are close to the data, we are not trained to kind of speak with superlatives and, kind of very finite language of this is the silver bullet, this is the absolute cure and anecdote. What it requires is a process of trial and error can happen a lot of times. But as you repeat experiments, as you invite other people to look at your work and to try to reproduce your work, that's when you find the reproducibility, the validity, and the consensus behind something. And so a lot of times, when I'm encouraging folks to understand what they're seeing online, it's to be wary of that very dramatic language of this is it, this is the miracle drug, this is the solution. Instead, look at what scientists are trying to, with humility, assuming humility, figure out the best possible option. And it really is never down to just one thing. So consensus and reproducibility are two very, very good boundaries to set on how you consume information, especially when it comes to cures and remedies. And I would say too, that the storytelling aspect of this is really important. I think that we get too, especially now that the pandemic is, almost a year in, and, the numbers are almost, too dramatic to really contextualize. When you see tens, thousands, hundreds of thousands, you get numb. And I think that those personal stories that can be relatable make it so much more human. People are really tired, but if you bring it home to an anecdote that is, true, I think that can go a long way.
Wow, thank you for doubling down consensus and storytelling, and how that sort of pierces in this age when we are all feeling so numb, and also helping us understand being able to reproduce, right? Trial and error. Where are you getting the consensus, not just from people, but from the data? Important points there. Thank you both. Let's go on to the next question. Given that you both have large platforms, let's now talk about how you use your platform for good. Talk to us about how you think about storytelling, this important point that you both brought up in the context of your work, how you use your platform to bring people into these large and controversial topics in a way that bypasses a lot of this current mistrust with reason. So help us understand the process. Either one of you, go ahead and begin.
Well, I'll just say, like, again, I start from a place of knowing that I want my platform to be trusted. I have no intention of turning my voice into a tabloid. So I start with me and I double check my information. I also really believe that I should have double checked information by places like the CDC or the WHO or scientists that are experts in the space. You know, one thing I even used a ton in my parenting is, have you asked an expert? You want to learn how to you do a cartwheel? Well, our friend Monica was a gymnast. She's technically the closest thing to an expert. I think we've lost what I said about confidence before in the internet. It's, you know, there's all these sort of tributaries you have to think about, but one is asking an expert. And I mean, did your uncle from Long Beach post this, or did the CDC post it? Like, that's a very important question. It seems like a silly one, but like when you're at the dinner, again, like I can only provide the layman's perspective, but when you're at the dinner table, ask, was that from, you know, your Uncle Joe in Long Beach, or was that from the CDC or the WHO? And so you can verify the information, not just in posts on the internet and what you're seeing, but in casual conversation to reinforce the structure of believing an expert in the mindset of the current human being, when the internet seems like we're all experts and we're just absolutely not. As a storyteller, I definitely think that the personal stories reach people. Sometimes it's hard to remember facts and figures, but it's much easier to remember someone's brother's name who was in the hospital. I also know, like, reducing the information into a graph, using colors. Like, these are elementary storytelling techniques that can be incredibly valuable when you're trying to hit the masses. Anytime you're putting a name, you know, the graphs with colors work, but anytime you're putting a name or a face on an issue, it will help increase the empathy, the curiosity. It reinforces all that. And, you know, you learn that in filmmaking school. So, and I think also reminding people that science and health affects us all goes a longer way than we think, because it sort of binds our humanity back together. Like, it's not this bifurcated issue where like this side believes this and this side believes this. We are all on the same team here, because the same team is health of the human race.
Great strategies there that you just shared, a ton. And as well, your idea around partnering with science, because even though the internet, as you said, makes us all experts, quote unquote, not really. Partner with an actual expert. Thank you for that. Jessica, what would you like to add?
Yeah, I think that this pandemic has seen the emergence of a lot of armchair experts, to be honest, especially ones who claim, knowledge and expertise in spaces that they previously have not been involved in. And we've seen that turn into a lot of confusion and now a deluge of information that people who earnestly want to make informed choices feel overwhelmed by, which is why I try to use my platform to be as judgment-free as possible, because shame should be as far as possible when you are trying to make these types of decisions. And I'm thinking specifically about parents who are trying to make decisions. The information that parents have been dealing with when it comes to school, when it comes to what to do about vaccines, or when it comes to even how to navigate social distancing with children, what that means for socialization, those are very overwhelming and triggering topics. And I think that because people feel instantly isolated by things that seem technical and out of reach because of the way that it's portrayed, I try to make this a judgment-free, shame-free kind of zone so that people, when they're looking at these charts and graphs, feel like they are actually understanding it. I mean, we have seen charts and graphs be manipulated by bad actors to spin the narrative. And as somebody who is extremely close to the COVID-19 data, I know exactly how to make sure that what you're extracting from that, whether it's a super clear, colorful legend or a couple sentences to contextualize the way that the lines are moving, that can go a really long way when it comes to people feeling less overwhelmed, less shame, and more like, okay, now this is all making sense to me. Because right now, the amount of information about COVID on social media is mind-boggling. And to know what is fact from fiction can take a lot of work.
Jessica,
I just also want to say,
please go. Your turn.
I want to give a compliment from a storyteller's perspective. The way that you run your social channels, you do something very specific, which is an Ask Me Anything. And why that is valuable, because when you're trying to tell a story or disseminate any amount of information, right, whether you're writing a script about a boy who loves his dog, or you're writing a script about COVID-19 and its health effects, you want to include the personal around any corner and never feel like you're talking at someone. So what Jessica does, which is really interesting, is I think it's every Friday, she does an Ask Me Anything. And what I think is sort of lost upon a lot of people who are trying to disseminate information is thinking from your audience's perspective, which is one of the first things you learn when you're in theater or filmmaking. You have to think where they're coming from. How do you include them, right? So the Ask Me Anythings that she has, she could post a ton of, here's COVID-19 and this data and this data and this data. And the chances of that being reposted and or even taken in, who knows? But by her saying, I'm here Friday night, you got a question, doesn't matter how silly it is. What it does is make the viewer go, me? I'll ask you. Oh, okay. Also, there's tends to be some anonymity in it. So they can say, will my child get COVID-19 from playing soccer? Like a question they might think is so silly and they're desperate to ask. But Jessica is opening up the gateway to some anonymity in question asking. She's also calling upon people, which is very different than posting and asking them to view it or take it in or repost it or try to get it out there. So the Ask Me Anythings, I think, don't underestimate in the medical or science community how helpful that can be to your audience.
I want to thank you for doubling down on this Ask Me Anything point, because really, I think what I heard from both of you, meet people where they are, and Ask Me Anything is a great way to meet people where they are. I love that you also talked about the emotions that people are feeling right now, right? And it's all of us. It's that sense of we're overwhelmed with information. Look, we're overwhelmed with our lives. We don't know where to start. And that sense of shame, that sense of isolation, it brings us to one place in our brain. But what you're doing is taking the brain and taking us higher with an invitation. So thank you. Great strategies. Okay, so let's take all of that and let's go even deeper and talk about how we're going to be able to innovate our overall process for inclusive storytelling. Inclusive storytelling. Let's talk about some of the ways that people can be included and be seen and have a sense of agency that they're a part of this story. So let's talk about some tools. And I heard a little bit of already, right? So when we think about human-centered design at core, right, that's about empathy, seeing problems through people's eyes and the perspectives of those involved. Jessica and Kristen already was lifting that up. It's also about collaboration. Everybody's been talking about that. So let's bring Ed back into the picture here. Ed, can you share some of your experiences here?
Yeah, human-centered design, which you just mentioned, is super important. It's really, really important to not assume that we understand where people sit and how they think. Everyone comes to the table with a different set of experiences, a different set of diverse opinions and everything. I've seen human-centered design take intractable problems within government and within industry and begin to fix them very quickly in creative ways. And I can tell you about one of those very things that we did. So when I was at HHS, I was asked to help the Indian Health Service, which is one of the 29 agencies at HHS, modernize and reimagine the way that they interact with patients using technology. And this was the third attempt at trying to do this. But we decided before we were even going to start designing anything that we needed to go talk to folks on the ground, not only caregivers that were employed by the government, but patients and folks that worked at the hospitals and the clinics, and not only talk to them, but actually walk with them and see their journey from beginning to end. And not only within the healthcare setting, but starting at home and in the community center and houses of worship and places like that, to understand the entire impact of the healthcare that was being delivered on their behalf through the federal government. And we just learned an amazing amount doing that. And we had folks come up to us and hug us and say, this is the first time, y'all provide healthcare to us. This is the first time we've ever seen somebody from the federal government actually come talk to us. And not only did you talk to us, but you listened to us. So what we did is we mapped people's journey through that healthcare system. We took all that information. We went to artists and said, help us illustrate these journeys. And we created these visual journey maps. And we created narrative stories about people's journeys in their experiences in their communities and with the health system. And then we published a large format book, and we sent it back to the tribal leaders. We sent it to folks that worked at IHS. And this remarkable thing happened. We were able to garner so much more understanding between all of us and so much more respect. And it was really about the journey and not the destination, to be honest with you. And I think that was kind of how we were able to bridge that trust. But I was very humbled. I went into this with my own biases and thinking, we can just throw technology at this, at some of the issues that we were seeing here. And what I realized is there are many, many other kind of easier things that we could do. My point is that human-centered design is super important. And, I think, at times we all come to the table with, biases, and we think we understand problems. We think we understand how people are going to react to what maybe a solution that we're offering. But a lot of times we really have no idea until we do things like journey mapping and really focus on human-centered design.
Thank you for that. You lifted up such an important point here. The journey, not the destination. And you also said something important, and I really want to continue to open up the floor to this really important point, which is oftentimes just through our own lens, we start with one worldview. We believe that when we start one place, it's going to end up a particular place based upon who we are and what we know and what we've seen. But if we open it up and we allow ourselves to be a part of the journey and not pre-describe the destination, we can get someplace else. I wonder if Jessica, Kristen, anyone, can you share any other examples through your work where you've seen that to be part of the magic? Because it's such an important point.
Well, I will say, again, I can only speak as a storyteller, but if you can make a gripping enough story, and I mean within the medium, if you can shoot it correctly, if you can use the right graphs, if you can have, all of these things, if you can grip your audience, they pause their conclusions and they go on the ride with you, right? That's why good storytelling is really, really important. So if you can get people to get on that roller coaster with you, they're not thinking about the conclusion. They're letting you take them there. I also think, and this is sort of a long game, but I think we all, maybe not you guys, but we all need to get more comfortable with saying, I don't know. I think it's something that I work on with my kids. And I think we are in the current state of Earth is that everybody knows. Everybody knows. I know. You don't know? And it's just like become like not chic to say, I don't know. And last year I sort of came to this conclusion and I was like, oh my God, are my children just awful? Or am I raising know-it-alls? And I was like, oh no, we don't say I don't know enough. I make it very deliberate and direct that I say I don't know to my children often when I don't know. And I don't even try to come up with the answer. I say, I don't know. you know what? Let's ask an expert. If that's how to put on the dog leash, to how to cook an onion soup, to whatever, those kinds of things will integrate into the younger generation, and we won't have this problem in 20 years. There's also a ton of books out there about this. Have confidence in saying, I don't know. Because when you don't know, what's your next logical step? You try to find the information. You have a growth mindset. You ask an expert. So I don't necessarily know that I'm qualified right now to speak on how we deal with all the people that know everything. But I certainly know how we cultivate this in the newer generation so that it doesn't really happen again. So that the swell of the internet where everybody knows everything doesn't sort of happen again. Yeah. I also think that within personal conversations, it's really important to think about motivation. Like, okay, well, you don't believe what's being said on that particular podium right now. Well, let me ask you something. Do you believe that person is inherently evil? Do you believe that person is out to get us? Like, you're sort of going under the story at that point and I'm talking more about these are dinner table conversations. Again, this is just the layman's perspective, but ask, do you believe that if Jessica says something you don't believe in, I would say to my friend, do you think Jessica's out to get us? You think she's an inherently evil person? And if the answer is no, then you have a gateway into discussing, well, maybe what she's trying to say is this, and you can sort of help move your friends and family through some of this information. But again, I also think that the responsibility falls on people who care about it to be the mavens in their community to help people like you and Ed and Jessica communicate this information to our smaller family groups.
So much to unpack there, and everyone was vigorously head nodding in agreement with you. So I'm just going to ask Jessica, Ed, anything else you want to piggyback on, add, lift up? So many important points there.
Yeah, totally agree, Kristen. So, from my perspective, when I came in, I decided to go do a tour of duty in Washington and try and fix some things that are broken about healthcare, and that's why I did it. And when I got there, I realized one thing was really lacking amongst all these super, super smart 80,000 people that work across HHS, the CDC, FDA, NIH, CMS, all of these places. That one thing that was missing was the people's ability to acknowledge failure, or people lacking the acknowledgement of failure. In Washington, in the Beltway, it's a pressure cooker, and failure is not typically tolerated or allowed. And that's really different than science, right? So and we do a lot of government science, but in science, the whole idea behind the scientific process is you come out with a hypothesis, and then you go and test that hypothesis. And it's not, you're going to fail part of the time. That's part of the scientific process. And, but in other parts of federal government, it's failure is scary, and we just don't even talk about it. We try and cover up failure. We try and make excuses for failure. So one of the things that I did as soon as I got out there is I started going around and publicly telling stories about a professional failure that I had. And the reason I wanted to do that is I kind of wanted to make myself vulnerable and say, everyone fails, right? And on my own team, one of the things that I expected people to do is kind of admit their failures and reward people for acknowledging those. And all of a sudden, the pressure just goes down, and allows for more creativity. That vulnerability is super, super important. And we're missing that in a big way. When we talk about media, we talk about social media in particular, where everything is a soundbite, everything is a headline, everything is a gotcha. It's very hard then to say, my bad, or to Kristen's point, I don't know. I don't understand, right? So one of the things that I think we really need to focus on is being intellectually curious and saying, I don't know, or I have a hunch, but I'm not sure if this is right. While at the same time saying, I had this opinion, or I did this and I failed, or I was wrong. I would encourage everybody that's listening to really take that to heart in your work and think about ways that you can promote this idea of failing. I could go on and on about failure and how important it is, but failing forward, failing fast, acknowledging that failure, that's a very constructive thing. From that comes wisdom. And wisdom is super important.
Thank you for that.
Mistakes are proof that we are trying.
Yes.
Jessica, let's get you back in here. Please go.
Yeah, I mean, just a super hard agree with both Kristen and Ed, and just a tiny bit of addition in that, you know, sometimes in public health especially, it's a frustrating but regular answer to say it depends. And that's because things are just not binary. It's not always yes, no, safe, not safe, totally healthy, totally unhealthy. It's just not like that, because we are unique people with unique bodies, unique immune systems, unique circumstances and backgrounds. And I think because of that, science just unfortunately lacks a lot of the nuance in the way that it's portrayed. It lacks a lot of the emotional intelligence in the way that it is communicated. And I think because of that, I try to remember that the actual science is not complete until it's communicated, and it's not really understood until it's communicated with all the nuance, the emotional intelligence, the considerations for different people's access and ability. Because a lot of times, if you just look at some of the basic science explanations, there's an underlying tone of ableism and ageism and all these things that are kind of like these sinister undertones. And I think, and even racism, let's just be really clear. And so I think because of that, it requires people within science or close proximity to science to weave in that like cultural competence, the emotional intelligence, the nuance that is just severely lacking, because otherwise that is really what's adding feet and miles away from the science community and the lay people. They feel more disconnected. They don't feel like they can relate. They don't even feel like they can approach with questions because of the way that it can be spoken about in such infallible absolutes. And I think that that is just so contrary to how our scientific training was intended. And I'm seeing that start to change, because what is required now for people to understand things like COVID-19 requires repetition, requires grace, requires not making assumptions. And I'll also add to the, in the beginning of the conversation when we talked about, how this is portrayed so that diversity and equity is prioritized. Not having single messages, right? It's not one answer for every single group. And because of that, that's where culture and emotion and all those things can kind of make those digestible pieces of information more impactful. They can go further into a community. So it's not just, one leader here and one leader there. It's all the individual community leaders and all the people who feel empowered.
Thank you for all of these insights. And we're going to even keep this conversation going and this dialogue on, I think, what you all have been touching on, which is you got to marry science and art. And by the way, I love what you said, Jessica. It's not finished until it's communicated, right? But then I also heard you all lifting up, how do you get to the science, communicating that, particularly when it is an iterative process. It's not done. It's going to continue to keep going. So let's keep down this road. Given that it's a science and an art, and storytelling is such a powerful way to help us work at that intersection of the needed science, the accurate data, and the transparency of information, as well as the art. The ways in which we're bringing people together in shared story. And you all have been already highlighting all the ways to do that. Let's continue to talk about ways in which we can build these bridges, even in this fractured climate. So how are we going to use stories for good versus being weaponized? Anyone want to start? Ed?
Yeah, so from my perspective, I think it's super important to start with data. And a lot of people, I don't think, quite have an understanding of public health and epidemiology. There are all these new terms that a lot of folks, lay people all of a sudden know about, right? So what is a coronavirus, or virus mutating, or what's a comorbidity? I mean, I've had friends text me and ask me about comorbidities that, have nothing to do with medicine or science and things of that nature, just as an example, right? But I think it's really important for us to understand that our communications and policy, government policy, needs to be predicated on data. And what we're learning, again, we learned this with SARS, we learned this with MERS and other infectious disease outbreaks, is that we have a splintered, disparate public health system from a data perspective. And a wise epidemiologist at the CDC once said to me, all public health is local, all epidemiology is local. And that goes to things like contact tracing. All contact tracing is local. This is a gumshoe detective type of a pursuit, if you know what contact tracing is, which is where we want to reach out to kind of the social circle or people that we've come in contact with when we get infected with the coronavirus, so that we can then go and inform those folks, say, hey, you need to get a test, you need to quarantine, so that we can stop the infection from reoccurring. So, but the issue is that there's not like this magical national data system where all the people at the local level, all the people at the hospital level, all the people at the state level, and the feds all report in this data. Jessica knows this very, very well because she is part of a highly successful and a highly valuable team of folks, part of the Atlantic and sponsored by the Atlantic. They're doing amazing things and helping people really unpack data around COVID. But we got caught with our pants down in the federal government in a big way. By the way, Congress, after major outbreaks, starting in 2003, Congress 3 times told HHS and the CDC, go create what we call an all hazards data approach to public health. Go create that big system where everyone can report this data and it's all consistent, it's understood, there aren't big gaps in the data, and it's coming in a time sensitive way, real time, near time data. 3 times Congress asked, 3 times we failed to create that system. We need to have a 9/11-like commission. Once the dust settles here, we need to go back and say, we're going to fix this data problem once and for all. Because without data, we have a vacuum, and that vacuum gets filled with anecdotes, conjecture, guessing, bias. It gets filled with politics. So it's super important for us to go back and really fill in the blanks around data, because the data then gets turned into information that people can trust, and then go backwards and look at that data. And then that information can then be communicated like we're talking about here.
Thank you. I want to get Jessica. Go for it.
What you said is just so deeply meaningful, Ed, because I think a lot of times people want to even partition science from politics. And I strongly believe that science is political for that exact reason, because science informs policy. We need the data from science to direct us to make these decisions, to have systems in place for data infrastructure, and data infrastructure that can be quantified and turned into understandable reports that say, we need to fill in these gaps. We need to create these systems. We need to prevent this from happening again. 10 years ago, I was working on pandemic surveillance and modeling, and we are currently living the situation that we were preparing for and had nightmares about. And I remember being that girl among my friends having, freakouts about a pandemic one day. And it wasn't me being clairvoyant. It was us saying it was a matter of time that this was going to happen. And to know that we got caught with our pants down, to know that we had systems in place that were at least on the surface preparing us for this, and that we defunded them, is just deeply troubling to me. There is, like what Ed said, a whole work that needs to be done that prevents this from ever happening again. And I do want to say too that data doesn't have to be intimidating. Data literacy can be increased by everybody. People can understand this, and I strongly believe, even from a equity perspective, that this data belongs to the people. This is their data. This is data about their health, and this is the stuff that goes into their communities and create systems that protect them. Because right now, if we'll talk about what this data is showing at the surface, we know that this pandemic has disproportionately affected communities of color. That is at the surface, with extremely disaggregated data that's not disaggregated, data that is very disconnected and disjointed and does not represent the diversity that we have in this country. So to know that we're already seeing this, very disproportionate burden of this disease at using data that is very incomplete, should be a huge sign that what is working right now, what is happening right now is not working on the data level. And I think that that is an underlying theme for everything we do in public health moving forward, because without it, we can't make informed decisions.
So important. Kristen, let's get you back in. Any thoughts from your perspective?
I was really just taking both of those in because I'm comfortable with saying I don't know. And that last question you asked is something I sort of don't know. And I really appreciate hearing both from Ed and Jessica about the lack of this sort of like, whatever you call it, universal cloud of data that we can all share. Because I only know, the only thing I feel comfortable with is like, once you have that, yeah, I know how to get some storytellers on board and I know how to make it digestible. And you always, you can add a little bit of comedy into these graphs and I guarantee you they'll go further. Like I know all of those tricks and tips, but I do think that, again, just like Ed was saying, that he went into the community and learned what life was like from their household to the health crisis they were facing. You have to go to the source. You have to go to the sort of be grassroots or go to the ground level, so to speak. And the ground level to understand this issue is you guys, because you have tried to put the data together, not had the data there, and then now we're here, we don't have the data. So it's like, we need to go to you and say, what do we need to fit? And I'm saying we as in the whole country, and especially the government needs to go to you and say, what do we need to do to get this in place? Because the steps beyond that, they're just tips and tricks for storytelling that can happen very easily.
Thank you for that. Really important. I heard the know what you don't know and be comfortable with that, and the importance of the collaboration. It's going to take all of us bringing our strengths. Thank you for that all together. And the other thing that I wanted to make sure that everybody heard was we fill in story when there is absence of it, whether it's the absence of data or absence of how to now even think about it. We, as the human condition is, we fill it in. So it doesn't go vacant, we fill it in. And so this importance of marrying science and art and storytelling is so critical here. So as we think about all of this, I want us to now talk, lift this up and say, what steps can and should individuals, governments, media, and businesses take to combat this health trust gap? Think about what you want for people to take away. What does this mean? What do you want people to do after they hear this important conversation today? Anyone want to start?
I'll say something. I mean, again, in knowing communication, I know how important patience is. And if you have a nugget, right? Like we've had some nuggets of maybe some action steps out of this. If you're trying to communicate that to anyone else, I always sort of parallel it with parenting. Well, I parallel everything with parenting because it's just consumes my life. But if I tell my daughter, be patient, chances are she's not going to be patient. She may be patient within that one moment, but if I explain to her the importance of patience, or I explain to her why she needs to be patient, and I have patience with her while I'm listening to her questions, I think it's really important for anyone, whether it's someone in the science community or someone in the medical community, someone who's trying to disseminate this information, or just around the family dinner table, that it's not just, I heard this and that's the fact. That it really is your parenting for me isn't just telling them what to do and walking away because I'm right. I know she should have patience. It's sitting down. And again, like what you said, meeting her at her level. I'm talking about my daughter here, listening to her point of view, even if I know it's nonsense, doesn't matter. You listen to it and then you work her through that. And I think it would be super helpful to have medical professionals, science professionals, people who are explaining this data to have some training in that patience that like, yeah, you're going to get to the podium and there's going to be some buffoons in the audience who are going to try to ask you some, circuitous questions, and you need to sit there, and part of earning their trust will be giving them your patience. I think that's sort of a hand in hand in how we can be earning trust is saying like, I'm here to answer all of your questions. Yes, you may think you said the answer 5 minutes ago, but you're not necessarily meeting the person at their level.
Important point, because oftentimes, especially when you're living something, you're living a story, you're living the data, you're living the science, you stop realizing that people don't take those things for granted, right? It's just not in their brain space. They're not living that story. They're living 50,000 other stories that they are overwhelmed with. And the patience is really about empathy. As we said, that's our story. It's not theirs. How do we bring them in and us into shared story, patience, and retelling, meaning exactly as Kristen said, important point there. Anyone want to pick up from that?
Yeah, sure. So to build on what Kristen said, just some things I've been thinking about as we're talking here today. You know, it's important for communicators. It's important for scientists, doctors, social scientists to take away, to start using some of the things that we've talked about here. Some of the other things that I'll just kind of reiterate. Let's act on information, right? That comes from data. Data and information are different, right? Data, a lot of times, is hard to understand it. It's the information that is gained from that, and then the visuals that come after that that really matter. So let's continue to act on data and information from that data and the visualizations, such as the COVID project, right? Let's make that the source of our decision making as we're telling stories. Number one. Number two. Let's get away from sensationalism. Let's get away from sound bites, and let's figure out how to tell our stories in a meaningful way, in a little bit longer format way, because that is super important to gain people's trust. And something else, let's figure out how to give individuals agency over their healthcare decisions, over their wellness, over their, agency over understanding of COVID and the pandemic. Because when you do that, you return control to them. They feel that they're in control, and that helps them. And a lot of so much of the time, folks feel like things are being done to them, whether it's public health people, the government, media, or whoever. We need to be doing things with them and for them. And meet as you said, Dr. Peart, we need to meet people where they are. So that's just some other ideas.
Thank you, Ed. So, Kristen, it looks like you want to jump in. Go ahead.
Yeah, one more practical thing about, what you were saying, Ed, is not just meeting them where they are and giving them agency, but also, like, if anyone's ever read Freakonomics, there's some really interesting stuff about incentivizing people in there. Yeah. And I worked on a movie this fall in the heat of COVID, and I was really nervous about going back to work. And thankfully, we had Dr. Anne Ramoen, who is from UCLA, the epidemiologist, like sort of guiding us through the whole thing. And I talked with her from a science communication perspective before we started about how can I be a leader in basically making, I know I will do my best not to get COVID, but how do we make sure that everyone's on the same page when you're hiring 100 crew members? And it came to light that incentivization is actually really meaningful to people. So I call, like, the practical steps. What I did is, like, I called Grubhub and I was like, hey, I'd love to share this and share your generosity. Can we go in on maybe giving a $200 gift certificate to every crew member, which is encouraging them to eat at home, right? Because that was when restaurants were still open, so they could get delivery. And I also said, okay, well, if I don't want to get COVID, I need to put my money where my mouth is, and I'm dramatically overpaid. It's embarrassing. So I was like, every Friday, instead of $5 Friday, on movie sets, we have $5 Friday, and you pick a ticket and somebody wins the pot. And I was like, during this sort of recession time, we're not going to have $5 Friday. I'm going to put a couple grand in this pot. And this is the I did not get corona this week pot. And so to incentivize people to be safe at home before they'd come back to work on Monday, there was a chance of winning some money every Friday. And it worked. And as far as I know, I think we were the only production to start and finish without a COVID case in Los Angeles.
Wow. That's great.
Wow.
don't sleep on incentivization. If you can get people on your team with sort of tips, tricks, and presence, it works and people are healthier. So I don't think that's a last resort by any means.
I mean, from a data perspective, Kristen, that's actually remarkable because I'm doing some infection prevention consulting with some film productions right now, and that we have not had that statistic on any of our shows. So kudos on that amazing track record. I'll also add to that there should also be some accountability when it comes to how these things are talked about. I feel very strongly that because we're mostly talking about digital content, I feel very strongly that there are ways that we can also protect each other by holding these, platforms and even publications accountable when things go out of line. And I think that is really important, especially now when we are saturated with misinformation and disinformation. I think that just this last week, we're seeing platforms really prioritize taking that stuff down. And I think that even when it comes to journalists and how they talk about things, like what Kristen mentioned earlier, there should be some journalistic responsibility when you think about these headlines, because these headlines are informing people's choices. They're making people feel less comfortable with risk or more comfortable with risk. And that plays out on movie sets, that plays out in offices, that plays out in people's pods. And when you have people getting this information in either sound bites or headlines or memes or Instagram posts, that is actually culture changing. That is behavior changing. And I think that we should, in our own way too, fill that space in addition to, to kind of like drown out the bad stuff, fill it with the good stuff, and lead with the fact that public health is it requires one of the most high levels of altruism in any field. It requires an others-centered mindset. And I think when people start thinking about others more importantly than themselves, that will make your work environments more positive and more healthy. It'll make your relationships more trustworthy and more respectful. And I think that all of that goes to the way that we use our words, the way that we keep each other accountable so that we're not repeating misinformation. And I mean, all of it is tied in together. It's none of these things exist in a vacuum.
Thank you all. I heard so much, but just a couple that I wanted to highlight. I heard the importance of patience, moving away from sensationalism, bringing a sense of agency, the importance of incentives, accountability, drowning out the bad by filling it with the good. And I heard something so important here, how we show up to the table, being other-centered. So not just us, but other-centered. These were all important points. And by the way, thank you all for such an important discussion. This is all the time that we have for today. But I want to thank our panelists for joining us to talk about this very, very important topic. So if anyone has any follow-up questions, please feel free to reach out to any of us on LinkedIn or Twitter. And to be sure to check out the live notes, the wonderful illustrations as well on the lifeology.io site. Again, thank you all for joining us.